Welcome. My name is Caroline Masbunchi, and I'm part of the global GBVIMS technical team. This resource is available both as podcast and video short. This episode on confidentiality and documentation is part of a series on case management in the context of COVID-19. For the full series, check out our website at www.gbvims.com. In this episode of the series, we will talk about confidentiality and documentation. When shifting case management services from safe spaces to remote service delivery over the phone, this will have an implication on how to manage confidentiality and documentation of GBV cases. This episode complements a guidance note drafted by the GBVIMS Steering Committee on GBV case management, GBVIMS, GBVIMS Plus in the context of the COVID-19 pandemic. This guidance note can be found on our website. In GBV case management, confidentiality is maintained through strict information sharing practices that rest on the principles of sharing only what is absolutely necessary to those involved in the survivor's care, with the survivor's permission. It is also necessary to protect written data about a survivor or a case through safe data collection and data storage practices. However, when conducting remote-based case management over the phone, confidentiality will look different in its application. First, case management supervisors or program managers should assess that if case management is provided from caseworkers' homes, the level of privacy availability to provide confidential care over the phone is sufficient. Therefore, the living conditions of caseworkers have been assessed by supervisors as being safe and confidential to conduct phone-based case management. For example, providing case management counseling over the phone might be challenging if caseworkers live in tents with limited or no privacy. Second, caseworkers must have obtained informed consent from survivors to conduct phone-based case management. This is particularly important for cases of intimate partner violence where survivors live with their abusers. Being contacted over the phone might put them at risk. Even when consent was provided, confidentiality should be assessed every time when establishing contact over the phone with survivors. Finally, safe and confidential storage of survivors' information should be available. This is what we will cover next. For remote case management over the phone, because the use of paper files with GBV case management data introduces opportunity for breach of confidentiality and data loss, which erodes staff ability to ensure confidentiality, it is not recommended to store paper files in caseworkers' homes. No hard copies of GBV consent, intake, or case management forms should be kept in caseworkers' homes. In this regard, caseworkers should not take notes. Consent should be obtained verbally for case management, referrals, and to record data using the GBVIMS. New technology have emerged to support the safe and confidential collection of data during GBV remote service delivery. And this is without the burden of safe storage of paper forms. Primero GBVIMS Plus is the latest database iteration of the GBVIMS. GBVIMS Plus is a web application that was developed to enable GBV humanitarian workers to safely collect, store, manage, and share data for case management and incident monitoring. It is also including a mobile application to allow frontline workers to safely track GBV incidents and individual survivors' progress as they receive case management services. In addition, the mobile application of Primero GBVIMS Plus has been designed to ensure that case management data cannot be retrieved by third party if the tablet or phone is lost or stolen. If such digital case management tool is unavailable, it is not recommended to store paper forms. However, it is understood that each program will have to outweigh risks and benefits of collecting such information, based on the duration of the lockdown and the requirements for their service provision. It is required that organizations consider the safety and confidentiality of information collected when making these decisions. In order to know what is right for your organization, we recommend you to consult with the GBV technical advisor within your organization or reach out to the GBVIMS global team by writing to gbvims@gmail.com. In order to record survivors' phone numbers, it is recommended that caseworkers use survivors' codes instead of identifying information such as their name. Phone numbers connected to survivors' codes can be saved in caseworkers' phones. Separate file, ideally password protected on caseworkers' laptops, can help to connect phone numbers to names of survivors when absolutely needed. When organizations are using hotlines, they will need to think about whether it is possible to collect information from callers, and furthermore, whether it is necessary. For example, what purpose will it serve? If information is collected from callers, the following should be considered. What information will be collected? How will it be stored so safety and confidentiality can be guaranteed? How the data will be used. Preparing for analysis early encourages for good use of the data. How data collection will be discussed with callers and consent obtained. Clear protocols with staff that make clear that the collection of data is not critical and should not be prioritized over supporting the survivor. In order to protect the identity and safety of survivors, all case management data is subjected to data protection safeguards. This is particularly important in the context of COVID-19 pandemic, when programs have to shift from safe spaces, center-based case management to remote service delivery over the phone. Organizations should have already developed a data protection protocol. Template and checklist can be found on our website. This will ensure that staff know how to deal with existing case files in safe spaces or offices when there is a lockdown. If storing case files in a safe space or office is unsafe during the lockdown period, staff will need to have allocated responsibilities to move or destroy these files. Protocols should be revised to consider new modalities for service delivery to remote phone-based case management in the light of the COVID-19 pandemic. Considerations around documentation previously outlined should be included in the revised protocol. When shifting service delivery from caseworkers' homes and over the phone, it is advised for organizations to ask their caseworkers to sign a data protection agreement. A sample is available on our website. Organization and context where the GBVIMS is rolled out should consider what it means to shift service provision to remote phone-based modalities. First, service provisions might stop for the duration of the lockdown. If service provision is shifted to remote phone-based case management, this might mean that caseworkers do not collect information from survivors as previously recommended. Therefore, there will no longer complete intake forms to populate the GBVIMS data. As such, GBVIMS will not be shared with the interagency at the interagency level for compilation, reporting, and analysis. If this is the case, it is important you inform the GBVIMS interagency coordinator at country level. Second, organizations might choose to keep collecting information. However, considering the limited case management that can be done over the phone, organizations might choose to use the emergency intake form. A template of the emergency intake form is available on our website. However, such forms should only be used if due consideration have been given to data protection consideration outlined below. In addition, the emergency intake form is only recommended if there is a plan of organizations or the interagency group to analyze this data. Third, if organizations are using Primero GBVIMS Plus, it is easier to compile data in order to produce analysis and share data at the interagency level as per the information sharing protocol. However, if organizations are not using GBVIMS Plus, they will need to consider how data will be shared with the focal points for compilation and data sharing. For example, if caseworkers do not have regular internet access, how will they send the incident recorder to the focal point? Can it be shared over the phone? Is it safe? Based on this consideration, organizations should decide if GBVIMS will be discontinued or not during the period of the lockdown. Information sharing protocols should plan for the interruption of data sharing. They can be amended if needed to account for this special consideration in the context of the COVID-19 pandemic. Should data sharing continue, it is recommended that organizations and interagency groups conduct analysis looking at trends in the context of the COVID-19 pandemic. Special attention needs to be given to trends related to intimate partner violence and access to services for GBV survivors. Thank you for listening to us today. To find out more about the series on case management in the context of the COVID-19 pandemic, check out our website. And as always, be responsible with your data and learn more at gbvims.com.